I think, there we
there
go.
we go. You got it. And Ronnie, where do you sit?
I am in Atlanta.
Atlanta, okay.
Yeah, so we're based out of Atlanta. So we have offices in Florida, Alabama, and Tennessee, but our main office is in Atlanta, Georgia.
Great. Well, you're gonna have only SoCal people on the call today, so
That's fine. We've been talking to people all over the country, Michigan, Colorado, Washington. So we're very excited. Constantly having calls with KWRI marketing for the launch, and really that's going to help us get the word out and utilize this as a recruiting tool.
right. So Ronnie, I mean, go for it and start. And Ronnie Suleimani is with Capstone Financial and teamed up right now with KW, white labeled as KWPerks. I saw Ronnie this week on a call with the region, and super exciting, launch for the benefit of our people. So Ronnie, take it from here, explain us like the benefits and what the game plan is. And whoever joined the call, please mute yourself. So I'm not gonna have any background noises. Thank you guys.
Sure. So, so we've been working with Keller Williams now for almost 3 years. So they started in the Southeast region, which is Georgia, Alabama, Tennessee, then slowly moved to Florida, Greater PA, Ohio Valley, and California. And finally, it got to KWRI, got to Carl Liebert, Mark Foley, and they said, this is something that we need to utilize for the entire nation.
Good morning.
Ronnie, if you wanna give me a co-host rights or whatever, I can help you to monitor the noises. I'm gonna mute you.
Okay. If I only knew how to do that here, participant, and well, we'll work through the noise. It's fine. So, so basically, what happened was, your industry, and most of you who have been in the industry for a while know that as 1099 contractors, it's very difficult to find affordable coverage. And also for people who go from W-2 status to a 1099, the number one concern is benefits. The number one concern is health insurance, dental, and vision. So what we were able to do was put together a program in one easy place for everyone to have access to. And it doesn't matter what state you're in. It could be California, it could be Florida, it could be Texas, could be Illinois. Our coverage is nationwide. And that was important when we rolled this out, because when we started, it was regional carriers. And then as we started to grow, we said, you know what, we're going to be going national with this, so we need to be prepared. So let me show you how easy it is and what we did to put this together. It's right there, KWPerks. I hope you like the name because I came up with it. If you don't, that's what we have, because we didn't want to say benefits. We didn't want to say, we wanted to say joining, we wanted to make it cool. You know, you join Keller Williams, these are the perks that you're going to have. Aside from the value add of being with Keller Williams, the #1 real estate franchise in the country, what else do you guys have? So this is the site right here. So everyone has access to this. I'll put in, put in my name, put in date of birth. We'll do a 40-year-old male. Someone give me a zip code in your area.
Do 90803.
Okay, so 90803, and we're gonna make us single again. And next thing you know, 10 seconds later, you are gonna have actual quotes for the health coverage for that individual. There it is. So you have 3 plans. You have a $2,500 deductible, $5,000 deductible, and $10,000 deductible. Right now, in the beta stage that we're in, it's a mix between the 2,500. It's a 50-50 split between the 2,500 and the 5,000. But when you take these premiums and you base it on the ACA or healthcare.gov, we are anywhere from 20 to 50% less than what's on the open market through healthcare.gov. This is a key differentiator of getting people over that hump. Now, the sad part, the statistic that we've learned, and this is very something that we're trying to address with this affordable healthcare, is that 60% of your agents in your marketplace right now have nothing, zero health insurance. And I always tell people, Harvard University did a study where the #1 reason for personal bankruptcy today in America is due to medical bills. So this is a great way now to help the people who are currently in your market center, but also the people who want to get into the real estate business now can do so. Okay, so a great thing that we added is an HSA. Now, everyone should utilize an HSA account, and you can do so whether you are on our program or you want to get it on your own, you can do so as well. Right there through Motive HSA. And what that does is lowers your taxable income, and you can now pay.
He said it's being delivered today.
You can pay for qualified medical expenses by utilizing an HSA card. And on our platform, you can invest that money in ETFs, mutual funds, cryptocurrency, whatever you want, because you want that money to grow tax deferred.
I think they'll be available in the morning. I don't think you need to park your car there tomorrow.
Ronnie, I'm sorry to cut you
or
off.
tonight. That's ridiculous.
Everybody,
That's a lot
please.
to ask from you.
Hold on, let me see if I can do that.
Yeah, just go to the participant and then just mute everybody.
Participants, okay, mute all. There we go. Yes, okay. So let me go back here and, all right. So this platform is very robust, okay? So any way that you can reduce your taxable income, you should take advantage of. On top of that, somebody say just wants dental. Delta Dental. Delta Dental is the largest network in the country. You have 2 plans that you can get there. And Vision is through VSP, another one, the largest network in the country. So there's nowhere you are in the country if you need any care that you cannot utilize this coverage. That is, so aside from saving people money on their premium, aside from saving people money on lowering their actual deductibles, you now have access anywhere in the country. There's many when you're on the state exchange, on the ACA, you can only get coverage in your state. Like Blue Cross Blue Shield, we found out in Florida, you can only get coverage in Florida, Delaware, Pennsylvania. Here, you have access to the entire country. From day one, we started this, everyone had access to long-term disability income insurance. Why do we get out of bed? Why do we work? Why do we get listings? It's income. You insure your house, you insure your home, you insure your health. No one is insuring their income, and everything revolves around that. So we got very, very lucky by getting Keller Williams an offer that's grandfathered in. That's a 25% discount from retail rates. That even if you work with a Mass Mutual advisor, he'll or she will tell you, we cannot duplicate this. This is fixed only for Capstone and only for Keller Williams. So while we had that and it was long-term disability, a lot of people said, well, what about short-term disability? Because we're constantly listening to the leadership like yourselves. What else can we offer? Now you have access to short-term disability in a bundled product. So not only is it short-term disability, hospital indemnity, accident coverage, and critical illness. So even while you're out on disability, here is something that could also help you for unexpected medical bills. as well. So this is great. This can be, this is guaranteed issue, no medical underwriting. You can literally sign up right now after this call for this coverage. On top of that, cybersecurity. Your agents, you and your staff handle personal information for your clients on a daily basis. Their tax returns, their bank statements, their social security numbers, right? There was one region that I was on a call with this week, not the market center, but the regional office got hacked last month. On top of that, there was a team leader who I work with in Pennsylvania. She was hacked as well. Her identity was stolen. Here's a way for your agents to protect their business from being vulnerable from a hack as well. So those are all the things that we put together for Keller Williams. And as you can see, this is going to be a game changer for all of you in your market center. So when you're sitting down with a recruit and you open up your Keller Williams recruitment packet and you show them all the benefits of joining Keller Williams, oh yeah, by the way, you're also going to have a one-page flyer to highlight all of these benefits as well. So let me, how do I unmute here?
People can unmute themselves if they have any questions, not a problem. This is, by the way, this is mind blowing. I didn't know about the other options, and I just sent my MCA in one of the offices a request to go and get cybersecurity quote right now as we speak. Yeah, I mean, did you want to open up for questions from the agents?
Yeah, no, absolutely. I want to have questions. So let me just reiterate as well. There's no cost. There is no cost to the market center for implementing this. That's number one. Number two, there's no admin, because if anyone signs up, they do it directly out of their own checking account or banking account. So there's no commission or deductions, anything like that, anything that anyone signs up for. So the only thing that they need to sign up for is they have to be with Keller Williams. They have to have a real estate license number, and they must know their market center, because when they go through the enrollment online, Keller KWRI wants to track and say, okay, which regions are utilizing this, which regions are not, and what's the reason? Because when I met with Carl Liebert, what was it, back in August, he was blown away. He's like, how did you guys do this? And again, we're taking great pride in this, because what we put together has never been done before for the real estate industry. Now, Redfin does have health insurance, true health insurance, but their structure is that they're not 1099, they're W-2s. That's how they're able to get around that. But here's the math. I met a young lady at family reunion. She did $9.5 million in sales last year. So let's do the math of what she would have made if she was at Keller Williams. You know what her take home was? $78,000. All because they say that you now have access to health insurance. So how much would she have made if she was at Keller Williams? Well over $250,000. So EXP is another one of your competitors. What they provide legally is not health insurance. It's not health insurance, and it's not cheap, because it is multiple components put together to look like health insurance. So Manny, why don't we open it up for some questions if anyone has any?
I've got questions. Hi, thank you so much. I'm Hallie Wright. I'm the team leader here for Coastal. So a couple questions. I heard you say that this is for people at Keller Williams, but that they have to have a license number. So does this not apply, or the perks not apply, for example, someone who has a team who maybe has an admin working for them that is
Okay.
not licensed? Does that make
All right.
sense?
Yes. So first and foremost, very cool glasses. I like your glasses. And
Thank you.
secondly, we have here, hold on. Let me do that again, because I want to show you here, and I apologize for not showing you this, but when you go on to the KW site, here, let me go to KWPerks. Let me go back to the homepage. If you scroll down, Hallie, right here, boom. So if you have W-2 employees, we have a designated team that just handles groups. So if you have a husband and wife or partner or whoever it is, and they have, let's say you have a mega team, and that mega team might have 5 admin, and they might have 10 agents, 1099. For the W-2s, you click on it right here, get started. They fill out all this information, let us know how many W-2s and how many 1099, and they work on it. They will reach out, they will get the information that they need, and then they will get you quotes. And I spoke to Mary Hall, who's running that department, and they are getting a tremendous amount of OPs and mega teams around the country already sending in, and we're getting in quotes as we speak. But that's a great question, yes, because we wanted to try to include everyone. When we started this, the focus was always on the agents, because those are the ones that had the biggest need. And then now we added the W-2s as well.
No, I love that, because it's a great thing to be able to leverage as a team leader of an office. But if you're a team leader of your actual team, to be able to offer your admins, people working for you who are unlicensed, some type of benefit like this, or maybe a contribution or a matching that, especially when they're recruiting and trying to grow and retain their own people. That's great. So my second question is, what's the enrollment date period? Is there any cutoffs? Is there a, we enroll once a quarter? Address that for me if you could.
How does 365 days out of the year work? This is
that works. Yeah.
this is completely open. That's one of the reasons why KWRI embraced this, because they really saw this as a recruiting tool. This is a great way to get people to join Keller Williams and to retain them, because you can apply for any of the coverages a la carte whenever you want.
Great. Last one, and then I'm going to let other people ask. So are most of the plans, is it HMO, PPO?
Okay. The plan utilizes a PPO network. The network that we use is the PHCS network. If I can go here, let me show you real quick. So we made this so user-friendly. So you go here, go back to the plan, and right underneath all the plans, you have the plan summary. But now let's say, hey, let's see if what doctors are in my area. So you go to this multiplan.com, they'll click here, find a provider. And let's see here. Yes, this very annoying green pop-up will come up every time. And then here, select the network. There it is, PHCS network. And let's, one second, I just want to make sure it's the right network. So everything that we did here is tried to make it as user-friendly as possible. I myself, I'm more of a telephone person. I like using the telephone. So we have not one, but 2 call centers, one in Atlanta and one in Phoenix, that it's almost like the bat phone. If that phone rings, they know it's a KW agent. So let's see here. What was the zip code again?
90803.
Okay, so we'll do 90803. And for the sake of time, let's do internal medicine. It's right there. And now you can actually put the doctor's name. If you're looking for a specific doctor, you can do that as well. But as you can see, in a 20-mile radius, there's over 300 doctors to choose from. And if you want to see a female doctor or a male doctor, or if there's a certain language, you know, Manny wants to find a doctor that only speaks Hebrew, we can do that too. So we can, so we made this very, very easy and informative.
That's great. Thank you so much for answering my questions. I appreciate it.
No, that's what I'm here for. Thank you. I think Jennifer raised her hand first.
Jennifer Goldstein. Maybe she's muted for a second. David, you have a question?
Hi, yeah, I have many questions. First question is, which insurance company is underwritten with?
Well, this is a self-insured plan, so it's through a captive. So this is something that was created for Keller Williams, and they're licensed out of North Carolina.
And so all these plans are PPO and the HSA. So that, as I saw, there were only two of them that were HSA, the 2,500 and the 5,000. It's because of the limit of the HSA. Is that correct?
No, it's because of the actual plan, the plan deduction.
I see. Okay, and for I had some questions about your disability. So you said there's a long term and there's a short term, right?
Correct.
What is the elimination period for the long term?
Man, you have good questions. So
I used to be an insurance agent, that's why.
no, that's a wonderful question. So the long-term disability can be built. I've been doing this for 12 years. The most common elimination period for long-term disability is usually 90 days, but they can go out to 120 days. They can even go out to 365 days, which never happens. So 90 is the most common. They can go out to 180. That's why the short-term disability is for 180 days. And then you can combine it with the long-term disability to start at 180 as well.
Okay, and what is the maximum benefit and how long is it paid? Is it for 2 years, 5 years, 65?
Well, it all depends on you. You can build it for 2 years, 5 years, 10 years, age 65, age 67, and even I've written policies to age 70. The maximum monthly benefit is $17,500.
And how is that calculated? Is it underwritten based on the agent's income, or is it just?
No, it's 100% your income. So the way that long-term disability is calculated is we take your taxable income, not your gross, your taxable. So for easy math, let's just say you make $100,000 a year. They multiply that times 60.6. So that's $60,000. $60,000 divided by 12 is $5,000 of monthly benefit. And the reason it's calculated that way, because that $5,000 monthly benefit is a tax-free benefit.
Because we are paying for the premium, that's.
You're paying for the premium with after-tax dollars, which is what you want, because a lot of people ask, can I write this off? And I'm like, why would you want to write off a $3,000 premium, or God forbid, now you're going to be taxed on 60 grand.
Sure. Okay. And I guess that's it for now. Thank you.
No, thank you. Jennifer, you still have your hand up.
Can you hear me now?
Yes.
Okay, I have a third party that I bought similar to this at the end of the year, and I can give him a 30-day notice and do this. I'm just wondering if we're going to get information so I can compare what I have to what you're offering and switch over.
Yes, I would recommend Jennifer, that you go onto the KWPerks site and call the 1-800 number, and they will be able to do a side-by-side comparison, but all the information is there as well.
Okay, that would be great. Thank you.
Sure.
What was that? You go to,
Other questions,
Why-
anybody? And Ronnie, I don't know
okay,
if,
good. And how do I get?
I don't know if you have a chat option over here, if you wanna, you can maybe
I have
drop
a
the.
quick question.
Yeah, no, we're not
Mhm.
we're not allowed to chat. It's
someone
a
on the
regulation
website.
through Mass Mutual.
Okay.
But I know Emilio has his hand up.
And
Okay.
if you can just mute Jennifer as well for a second.
You're so good. Thank you. Oh,
There you go.
Okay.
Good morning. This is Emilio from the Calabasas office. I jumped on a little bit late, but from what I understand, this plan is an individual plan for KW agents. Is there a family plan for KW agents?
No. This is there's individual partner, spouse, and and family plans as well. Everyone at Keller Williams and their families are eligible for the health insurance. But because you were late, that means you got to pay for the health insurance for everyone on the call.
Everybody? All right, I got you.
He makes enough money, he can do it. But Emilio, we're gonna show the recording later today or tomorrow, so you can go back and see what Ronnie was sharing. It's mind blowing.
No worries. I'm just taking 50% off of everybody on the call now, so that's good.
So yeah, so we're super excited. You know, this is 3 years in the making. We grew. We had a lot of, you know, it was a learning curve, you know, which each region, you know, communicates differently, and you know, when they do their team meetings, what we really ask is that we get invited to your training meeting. Some market centers do it once a week, some do it once every 2 weeks or once a month. This way I do a presentation. Obviously it's not as long as this because I want to be respectful of your time. It usually is around 10 minutes. This way we introduce the program, let everyone know what they have access to, and then we will also introduce the capstone financial advisor that's going to be responsible for your market center, because you guys are busy, you guys are in the real estate business. Let us help you with the recruiting, and let us help your agents get the answers they need to whatever coverages they're looking for.
Yeah, and Ronnie, I'm gonna you know, send you a separate email to coordinate with all the at least my offices for sure. So thank you, David.
Yes, I got one more question. Ronnie, as you know that the ACA open enrollment is November through January 31st. What if somebody just has already health insurance and wants to change to your plan? And let's say 3 months from now, they're not happy and they want to get back. Is there a way that they can get back to the ACA? No,
you have to have what's called a qualified life event.
So this one doesn't.
Right, so it's either a divorce or a marriage or the birth of a child, something like that. Then they can hop back on to the ACA. It could happen again, but I don't see why anyone. So far, we haven't had too many people that were dissatisfied from what we had before. This is completely different because this is real major medical.
Okay. All right. Thank you.
Any other questions before we're gonna let Ronnie go? And again, we're gonna bring Ronnie to speak virtually on the team meetings. Let's see you're you know, coming to visit sunny California, Ronnie, sunny California over here. So we can.
We're planning on me coming out there probably in June, because you know, you guys are definitely one of the largest regions, the whole state. There's Texas, the Southeast region, the Northeast. So I will be making some appearances in the regions. You know, wouldn't mind getting out of the office and back to traveling again. So probably sometime in June.
Awesome. Cool. Well, by then, again, I'm going to coordinate with you individual team meetings for every office, and we'll, get more information. But that was amazing. It's very exciting for our agents, for sure. So congrats to all of us, and thank you again to you, Capstone Capital, and KW. So we'll talk soon, Ronnie. Thanks for the
I
time.
appreciate it. Thank you, Manny. Everyone, thank you so much for your time.
Thank you.
Thank you.